Hi, I'm Dr. George Springer. I do the functional medicine here at LifeWorks Wellness Center. And today's topic, we're going to talk about thyroid. That's one of the subjects that's near and dear to my heart because I spent probably the last 8 years or 10 years or more and untold thousands of dollars unraveling the thyroid. It's in epidemic proportions these days, and we see more and more patients having thyroid issues. And there's a couple of different reasons for that. One of the biggest reasons, quite frankly, is that patients come in here and they've been to a lot of other doctors, and what the doctors are doing, they're actually treating the lab test and not the patient. Now, what I mean by that is a patient comes in and they're tired, they're having trouble losing weight, they're losing their hair, their nails are brittle, they got constipation, they're cold intolerant. These are all symptoms that relate to thyroid, and they have every single one of these. But then the doctor runs the laboratory test, namely TSH and T4 is primarily all they've had done in their labs, and they're proclaimed okay. So they walk away with all the same symptoms, and their thyroid is pronounced as being okay. And what I find is we get a little bit more, in terms of the correct evaluation, the more in-depth evaluation, we find out that they're not really okay. So the real answer is to treat the patient and not to treat the laboratory test. And that's what we try and do here at LifeWorks, is to really get in and to evaluate more thoroughly in terms of what's there. The labs that are done, as I mentioned already, is TSH and T4. So if you have labs that your doctor's done, you can take a look. And these are important pieces of information, but they're only about a third of what needs to be there. There's other parts of the thyroid evaluation that are equally important to know what's going on. So there are variables within the thyroid that need to be evaluated more thoroughly. But just as importantly, we also need to make sure there are certain key elements, like iodine. Most patients coming in here being evaluated have never had their iodine levels truly looked at. You can measure iodine levels, and iodine is the key mineral. And it is one of the major reasons that we don't have the thyroid working the way it should, is we have iodine deficiencies. But in addition to that, there's another element to this in the same group of family of the chemicals as iodine, and that's bromide. Sometimes bromide excesses are actually interfering with thyroid function, along with other kinds of toxic chemicals and things in the environment that can begin to impede thyroid function. So if this all sounds a little complicated, it really isn't. It's just a matter of making sure that all variables are covered. And the thyroid seems to be more sensitive than many other glands that are involved as far as the body are concerned. And that really speaks to another point, which is that the thyroid is really one of several hormonal glands in the body. And if you try and treat the thyroid in isolation without looking at the whole other part of the endocrine system, you're really trying to play a symphony with just one instrument. And that doesn't work very well. And so we tend to look at the thyroid in conjunction with how does it function relative to the adrenals. Now, is there a relationship between the thyroid and the ovarian function, for example, in females? We know, for example, that if you're having thyroid issues, that you also need to support the thyroid. Support the adrenals in order for the thyroid to actually work the way it should be. So those are all important factors. The other thing that's very important is that sometimes patients have been diagnosed as thyroid, even if whether the labs are there or not, and they're putting on a particular drug. And sometimes, and most of the time, that's going to be Synthroid or one of its derivatives, which is T4. Now that's the thyroid hormone that's being made by the body. The body has to convert that into a form called T3. And we find a lot of times the body doesn't have the necessary enzymes and or the cofactors to those enzymes to allow for that conversion. So that's another thing that's looked at. So if it sounds like there's a lot to be learned about the thyroid, there is. I invite you to come to LifeWorks Wellness Center. We'll be glad to evaluate your thyroid thoroughly and, more importantly, educate you about what you can do to improve your health. So call LifeWorks 727-466-6789. We'll be glad to help you. Thanks.